which is exiting a group practice. Well, as you all know, it is always a pain everywhere, of course. Whenever you have to terminate, exit, or finish off something, it is always a pain. And there are innumerable possibilities. So what you can do is you can have a broad-based formulae. For that purpose, we have actually found out that all these exit policies can be done in a better manner if you have a private limited company. And you have a lot of different possibilities, like you need to fix up some exit remuneration according to the present performance of the company. That is one very good way of doing it. If the company is doing good, well, the member who is exiting has a better chance of getting something. But if in some case the company is not doing well at the time of a member wanting to exit, well, he is not going to get a good remuneration for all the investment and the contribution he has made to the company. Vis-a-vis, he might even try to postpone his exit. And that is why, for me, the exit remuneration according to the present performance of the company is the best and the most suitable way. Well, and how do you decide that? It depends on the primary investment, the number of years that the person has actually been inside the company, the contribution to the company, the status, which is the profit or loss of the company, and the most important aspect of an exit or a deterrent, you can say, is the clause that he or she cannot practice in a radius of 200 kilometers from the primary center of the company. Well, this actually is very important because there have been many instances where a member has worked for a few years and then he has tried to hijack the entire center. This has happened in many places across the country, and that is why this should be a very firm and ironclad rule that he or she cannot practice in a radius of 200 kilometers, so that there is no question of a hijacking of the practice. There have been instances where a doctor has taken the entire staff with him and has left the center. So all these things have to be kept in mind while we are actually trying to form our exiting formulae. Some important terminology which I would just like to briefly touch upon is conflict of interest. Whenever there is a group, the ideology has to be such that there is no conflict of interest. If I can give you a small example, well, if a doctor gets more money for seeing the patient, he or she is going to try and see that he or she actually diverts the patients to his or her name. And that is why the ideology and the fundamentals have to be in a way that there is no conflict of interest. But well, this also has to be guarded against complacency of interest. If one doctor does not work and still gets the money, well, that also should not happen. So it's a fine line of balance between conflict and complacency. Very nicely said is close your eye and open your eye. But it's the other way around. It's close your eye and also close your eye. Revenue sharing. This is very important, which determines your staying in the group or exiting the group. Because what at our place we do is, well, a doctor cannot take innumerable leaves, right? So we always make all the doctors a daily wager. I am using the terminology daily wager. If you are in the hospital for a certain number of days, you get a fixed income. And over and above that, for operating any patient, you also get a very minuscule amount. Say, for example, you operate a LASIK patient, you get 1,000 rupees as your own money. Besides that money, if you charge 30,000, the entire 29,000 goes to the company. Well, leaving your ego is a very big
Hello.
possibility, and
Hello.
it has to be a lot period. Well,
Yes, sir.
if you join a company, you cannot leave the company before a certain amount of time. And very important is the concept of ombudsman. Well, there are so many heads, so there are going to be some differences. So what do? You should have a person who does not have any conflict of interest or who does not have any ulterior motive with the group. So you have to select a person for as an ombudsman, say you are practices in Ahmedabad, you select a friend from Nagpur or say Kolkata and make him an ombudsman. He is aware of the day-to-day situation, and whenever there is a conflict or there are two groups, he can be the deciding factor. Something simple is 10 lakhs for 10 years. If there is a 10% profit year on year, well, this person can get about 20 lakhs at the end of 10 years for his. This is a very broad-based formula that I have shared. Well, the other thing is you can initially only say that a very simple interest, a basic interest for all your contribution might be given. If you want to leave after say 7 years, it would be 2%. If you want to leave after 10 years, it could be 3%. Something like this also can be worked out as an exit formula. And of course, you also have to make sure that the exit formula remuneration has to be in installments. It cannot be as a one go, otherwise it will be a big burden on the company. So all these things have to be actually tied up inside the clauses, and it will also always work well. A big example, some examples are a refractive surgery center we had. In fact, I had two centers to begin with, and one of them had to be dissolved because there was a heartburn among the partners, because one person was doing more surgeries and other was doing less surgeries. Well, of course, the revenue sharing was, because it was a surgical center, not conducive for a group, and so we had to close down that refractive surgery center. But well, our group practice is still on. Right? With this, I will stop sharing my screen.